Assalamualaikum everyone, this is Jamia, Mehek, Satya and Samira, and today we are going to be representing about drug addiction and its impact. Now, me and my team are going to summarize the basic points of the above slide. So now we are going to start with the introduction. Addiction is the only prison where the locks are on the inside. Drug addiction is a chronic relapsing disorder characteristic by compulsive drug seeking, by continued use of despite serious negative socio-economic and health consequences, and by loss of control over drug use. Repeated drug use arises from the drug neurochemical actions that produce positive reinforcing effect and progressively leads to neurobiological changes in the brain, reward circuits, and behaviors characteristics of addiction: tolerance, sensitization, dependence, withdrawal, and craving. Today, for pleasure drug used to drug addiction might also involve an additional source of reinforcement such as the reduction of negative emotional state during acute absence. Today, me and my team will be discussing few points related to drug addiction. These are at first origin, bad effects of drug addiction, statistics, prevention, and conclusion. Now we are going to start with the origin.
Is chronology origin. The basic of this origin is like what happens in the past is familiar to our present. The things that are going to happen in the past is also combined to our future. So the basic things of drugs that were happening millions of years ago is also now reflected in our present. So today we're going to discuss about that past and that history of the drugs and those effects. I goes to the 2010 for cocaine was another drug that was very popular in part of atheism clubs by Sedative Freud and American physicians that cocaine could help relieve asthma, depression, high fever, toothache pain, and host of many other problems like asthma. Cocaine was brought by different grocery stores and different stores in US. And many general surgeons and army surgeons also use this stuff. Cocaine became an instant hit and drug addiction to people. During the 2 decades, however, consumed good grew from cocaine effect. Some of the concern was fueled with the abductive with African American who used cocaine and became extra strong and dangerous for the people as a drug.
Effects of drug addiction. Effect of drug addiction people with addiction issues which could include lung or heart disease, stroke, cancer, or mental health conditions. It also affects our family members because of drugs reduce capacity to learn and work, hamper work, power to manage stress and take decisions. For example, it is now well known that tobacco smoke can cause many cancers, can cause several dental problems known as mouth, that upsets can lead to overdose and death. In addition, some drugs such as inhalers may damage or destroy nerve cells. The impact of addiction can be far-reaching, such as cardiovascular disease, stroke, cancer, HIV or AIDS disorders. Besides personal and family distress, additional health care cost and loss of future productivity place burdens on the community. Mental health problems also can be seen on the addicted person. Drugs use also diminishes health, physical appearance, and motivation. It impairs judgment, leading to risky decision makers. Drug addiction reduces physical and intellectual performance in many areas. It also causes the increase of accident in street, just like driving after drinking alcohol. Drug driving puts the driver, passengers, and others who share the road at risk. This areas form a keynote of what is sometimes called the brain's reward circuit. Drugs overactivate this circuit, producing the euphoria of the drug high. But with repeated exposure, the circle adapts to the presence of the drug, diminishing its sensitivity and making it hard to treat pleasure from anything besides the drug. The external environment plays a role in stressful feelings like anxiety in age, which characterizes withdrawal after the drug high fades and thus motivates the person to seek the drug again. It also increases the separation of HIV and AIDS.
Among Americans aged 12 12 years and older, 37.30 million were current illegal drug users. Among them, 21.4% of people 12 and over have used illegal drugs or misused prescription drugs within the last year. 138.543 million or 50% of the people aged 12 and over illicitly use drugs in their lifetime. Usership among people aged 12 and over is down 0.4%. Not just that, 25.4% of the illegal drug users have a drug disorder, 24.7% of those drug disorders have an opioid disorder. This includes prescription pain relievers or painkillers and heroin. And to include some more statistics, 2% of males and 70% of females used illegal drugs or misused prescription drugs within the last year. 70% of users who try an illegal drug before age 13 develop a substance abuse disorder within the next 7 years, compared to 27% of those that try an illegal drug after age. 70.4% of young people use an illegal drug by the time they graduate from high school. These are 5% of 8th graders, 20% of 10th graders, 24% of 12th graders.
To speak about the prevention of drug addiction. Mainly talk to their children about the risk of drug addiction and misuse of it. Listening. They should be a good listener when their children talk about their peer pressure and be supportive of their efforts to resist. They should also get a good example. One should not misuse alcohol or addictive drug addiction. Children of parents who misuse drugs are at greater risk of drug addiction. Strengthening the bond, working on one's relationship with their children. A strong, stable bond between a person and their child would reduce the child's risk of using and misusing drugs. Monitoring one's cravings. It may seem that one has recovered and does not need to keep taking steps to stay away from drug-free, but the chances of staying drug-free will not be very much higher if one continues seeing the therapist or counselor. One should get immediately help if they use drug again. If they start using the drug again, they can consult their health care provider, mental health provider, or someone else who can help right away. Now the conclusion.
One can stop drug addiction if they will try to do their best. One must take early treatment or medication or medical care if they seem to feel like that they need some sort of substance or some sort of drugs to stay healthy or to stay fit. The safest bet is to stay away from drugs. People who get addicted to drugs have little chance to leave their drug addiction. They end up ruining their life and cause a lot of problems in their life due to drug addiction, and also do a lot of suffering to their loved ones.
Addiction is stressful and confusing for everyone involved. One may experience a wide range of emotion as the family members of someone who suffers from addiction. One moment they feel like they want to help the person, the next moment they feel angry or resentful. They may feel guilty a lot of time and ask themselves for what they could have done to prevent this addiction. The truth is that it is not their fault and it is not too late. Help is available anytime and anywhere. The first step is to help the addicted family recover and to help one's own self and understand the addiction. Hence, educate yourself, take care of your emotional and physical health, and never hesitate to remove yourself from unsafe conditions.
Thank you everyone.